It seems every day we hear about another deadly shooting somewhere across this country. Well, after the school shooting in Uvalde, Triad leaders discussed ways to curb violent crime. The Forsyth County District Attorney said he fears more could come in the months ahead.
There's not a person up on this panel that would disagree with me on this. We are all worried about this summer.
Now, maybe you've heard that idea before, that crime goes up in the warmer months. WFMY News 2's Ariel Cadet is digging into it tonight. She looked at data from Greensboro Police and spoke to someone who knows firsthand.
This past weekend, mass shootings across the country left at least 17 people dead. In the Triad, 7 people were shot during that time. You might have heard violent crime goes up in the summer. Dr. Ayesha Lovick, a trauma surgeon at Cone Health, says she sees a lot more injuries this time of year.
I think that there is similarly more opportunity to be involved in activities that potentially put you at risk for being involved in violent crime.
The numbers also show a rise. We received data from the Greensboro Police Department for the last 5 years. And each year there's a rise in violent crime during June, July, and August. Dr. Lovick says she thinks there are several contributing factors.
The first kind of category, if you will, is mental health. I think there's more opportunities for recreational activities in groups when you couple decreased coping skills and increased triggers, you have increased opportunities for conflict.
She says another factor is economic disadvantage. It has a bigger impact when kids are not in school and aren't occupied throughout the day. She also says kids growing up in lower income families have a harder time finding a summer job.
School is a place of refuge for them, and without those opportunities to have that, they're put in positions where they're at increased risk of being victims of gun violence.
When the summer months roll around, Lovick says the staff prepares for the influx of patients, and it can be stressful.
It can be overwhelming in the moment, for sure, in terms of the volume of patients that come in. Oftentimes when there's an episode of violent crime, especially with gun violence, there are multiple victims that come in either at the same time or kind of right around the same time.
Dr. Lovick says Cone Health has a program called Cone Core that seeks to decrease gun violence in the city. It targets teenagers between 14 and 17, pairing them with a mentor who can help them find a summer job or activity.